Kogo News Time is 8:12. Do you binge watch shows? Well, it turns out it can be very, very bad for your health. Joining us on the Kogo News Live line this morning, Dr. Pablo Zeballos. And good morning, doctor.
Good morning. How are you doing?
Very good, thank you. Tell us about this new study about binge watching.
Yes, wonderful. It's actually a very, very large study that just came out recently from Japan that shows that there is an incredible risk of health hazards with binge watching. An example is if you watch more than 2 hours of television a day, you have a 40% chance increase in actually getting a DVT or pulmonary embolism. And it's amazing how the death rate actually increases if you actually watch TV more than 5 hours at a time, which is obviously what binge watching is.
So let's talk about a DVT or an embolism. In layman's terms, it's a blood clot, right? That's
correct. A DVT is basically a blood clot that occurs in the legs. If you haven't been moving around much, during the daytime, if you're sitting for prolonged periods of time, you can get a pool of blood in the veins in the legs. And if that happens, you can get a blood clot. And the danger that happens is if the blood clot in the legs dislodge and goes up to the lungs, that's called a pulmonary embolism. And when you get a pulmonary embolism, that can block oxygen that goes to the lungs and can cause multiple health hazards such as, heart attack. You can actually end up dying, basically.
Can these embolisms, where else can they travel besides the lungs?
They usually travel the lungs. The ones from the DVT, from the legs, will travel mostly to the lung and can cause the pulmonary embolism. But you can have other clots that go to the brain, but that comes from different sources from the arteries. So when we're talking right now specifically, we're talking about the clots of the legs that can travel to the lungs, and that's what's going on.
Okay, let's say that it travels from your legs to your lungs because you're not moving. Is there anything you can do about that, or by the time it hits your lungs, is it pretty much sudden death?
What happens is if it travels to the lungs, the symptoms of that will be shortness of breath, chest pain, kind of heart racing. And so if that happens, you basically have to go to the emergency room. And they can actually give you blood thinners, but it's a very intensive process where you may be on blood thinners for quite some time. But the most important part of this is actually the binge watching, the sitting sedentary for prolonged periods of time. The interesting thing about this study is that this showed over 80,000 patients. They followed over a 20-year period, and this showed is 2 times increased risk of getting a pulmonary embolism if you watch TV more than 5 hours at a time. And so in the past, we wouldn't have that because if you watch a show like Seinfeld or anything like that, you'd get up and after that it was over. But now everybody's recording Game of Thrones, House of Cards, and then deciding to watch it, all of a sudden on Saturday morning or Saturday night. And that's the issue.
So with the streaming television, this has become more of a problem.
No doubt about that, because not only when you stream a television, you have no commercials. And so what we used to tell patients is if you're watching TV, between commercials, go ahead and get up, stand around, go get a drink, move your legs around. But now, since you have no commercials and you have stream live, you can basically sit there literally for 3, 4 hours, 5 hours, just watching TV, not moving. And of course, what happens when we're sitting there watching for 3, 4, 5 hours, you're eating also snacks, sodas. It's kind of a vicious cycle.
So is the best thing to do if you are binge watching to just hit the pause button every once in a while and just get up?
No doubt about that. This is what I tell patients whenever they're watching, even if you're watching regular TV that has commercials, I always tell them whenever a commercial comes on, stand up, move your legs, kind of pump your legs to your calves. When you pump your calves, that moves the blood flow from the veins up to the heart and lungs without any issues. And so I always tell patients, go ahead and do that. Just get up, move around. If you're hopefully you're not binge watching, but if you are, every hour get up and move around for at least, usually 5 minutes. And that should really help you out a lot. But definitely binge watching is something that I would definitely not recommend at all.
All right, Dr. Pablo Zeballos joining us on the Kogo News Live line.